Thank you for joining our webinar this afternoon. I'm Caitlin Crossley from Optimity Advisors, and I'll be your moderator. Gareth Harper will be presenting. This webinar is about new models of care and economic evaluation. Before Gareth starts, I'd like to quickly introduce today's speaker, explain how to ask a question using GoToWebinar, and finally, how to access the webinar recording. Gareth Harper is a senior manager at Optimity Advisors Europe and leads the economics team. Gareth's full biography is available on our website, or you can connect with him on LinkedIn. Today's webinar, Economic Evaluations of New Models of Care, is the fourth in a series of 6 webinars we are hosting on evaluation methods. If you'd like to listen to our past webinars, please visit our website. Before we get started, I wanted to mention that we welcome your questions throughout the webinar. All you need to do is type yours into the questions window, which for some is the 6th blue bar down on the GoToWebinar control panel, and hit submit. At the end of the presentation, we'll get to as many questions as we can. Finally, we're recording today's webinar and we'll post it on the Optimity Advisors website. We'll send you an email once it's up in case you would like to watch it again or forward it along to a colleague. Without further ado, I'd like to turn the program over to Gareth.
Thank you, Caitlin. As Caitlin said, what I'm going to be talking about today is economic evaluation in support of new models of care. Before I get into some of the detail around that, however, I'd like to talk about some financial context and background. I'm sure that all UK listeners will be extremely familiar with the financial challenges facing the NHS. The 5-year forward view, as set out by Simon Stevens, mapped out a vision for this. And in this document, the NHS Chief Executive set out for the NHS the financial challenge over the next 5 years of a need to deliver savings of £22 billion. The New Models of Care Vanguard programme includes a number of pilots focusing on integrated care delivery, for example, multi-specialty community providers and integrated primary and acute care systems, which are seen as central to delivering these efficiency savings. The NHSE have provided funding for these pilots and understandably will want to know what is working, where and how well. This means that local areas must undertake an evaluation and in particular undertake an economic evaluation and do it well. At this stage, it is worth highlighting that this is not solely a financial concern. This needs to involve health economics expertise as well. This framework, which has been presented in previous webinars, has been developed by the Treasury and sets out the policy and implementation process. And as you can see, throughout the implementation process, from rationale, objectives, appraisal, monitoring, comes evaluation, which is an exceptionally important component of this overall cycle. So what I want to address here is economic evaluation. What is economic evaluation trying to address? As I've said, it forms part of the wider evaluation framework and in particular addresses 4 key questions. Does a programme deliver value for money compared to a set out and defined alternative? At what costs were the outcomes and the impacts delivered? What aspects of the programme drove the costs and the savings? And what are the data requirements that are needed to enable local decision makers to assess the value for money of the programme itself? NHSD will need to know the answers to these to be able to report back progress against delivering the £22 billion efficiency savings target. This slide sets out the NAO value for money or fabric model, which conceptualizes performance in its context and how it can be measured. It is a useful framework for considering the questions being asked. In particular, An economic evaluation is concerned with the relationships between the resources spent and the outcomes achieved. When these two concepts are considered together, we are considering and thinking about the concept of cost effectiveness. Economic evaluation can be used in both summative and formative forms of the evaluation framework. These concepts have been mentioned in previous webinars, and I'd like to discuss these in a little more detail in order to, again, to understand the difference between the two and understand what they tell you from an economics perspective. To reiterate, a formative economic evaluation is part of the overall learning and implementation process. It's an evaluation at a particular point in the program and a particular point in the implementation, and can assist with informing program development and implementation. In economic evaluation, this can help highlight those areas that are major cost drivers. It can also highlight any data collection gaps, and can be used to inform what's known as a cost consequence analysis, to inform participants and stakeholders about a range of costs and outcomes. And I'll talk about cost consequence analysis in a bit more detail shortly. In contrast, a summative evaluation is part of the decision-making and planning process, and it is an evaluation often at the conclusion of a program, focusing on outcomes, final outcomes, and impacts. And in economic evaluation, the questions here are around whether the program actually delivered value for money and was affordable. Data will be collected to focus on reporting the relationship between the impact of the new program and the net costs of implementation. And this kind of evaluation is likely to be informing a cost-benefit analysis or a return on investment calculation, but can also be used in a cost-consequence framework as well. On those two last slides, I used phrases like value for money and affordability, and I just want to spend a short time making the distinction between the two. They are both very important concepts in economic evaluation, but have very different meanings. Questions around affordability include, is the net cost within budget? Do the organisations involved have the required financial resources to implement the change? It's also important when thinking about affordability to understand the timing of expenditures relative to available budgets. For example, are certain implementation costs front-loaded in the programme? These questions are very much linked to the financial case of the overall business case proposal. Related to this is the question of value for money. Questions of value for money include, is the net expenditure worth it? And do the outcomes or the benefits from the process justify the expenditure? Again, timing is important. Are the benefits likely to be realised now or later? In addition, benefits might not just be financial savings, but could also reflect wider outcomes, for example, health improvements or improved patient experience. These questions are linked to the economic case of the business case. So, with that in mind, what do we need to do to undertake an economic evaluation? What I want to address here are some fundamental issues that local teams will need to address when considering commissioning an economic evaluation of their local integrated care scheme or new model of care. First of all, there is the issue about what are the key questions and the objectives of the economic evaluation. Is it about demonstrating value for money, for example, to secure ongoing funding and support? Or is it more about understanding the nature of costs and outcomes and how they are connected? This is related to the issue about whether you are interested in a summative or formative evaluation. Secondly, it is assumed that the economic evaluation will be undertaken alongside a wider evaluation of processes and impacts. Are there going to be arrangements to ensure consistency in timings, data requirements, for example? And thirdly, and perhaps most importantly, is there an agreed logic model, which were discussed in earlier webinars, that is shared by all stakeholders? This logic model will need to articulate the narrative behind why the new model of care is expected to generate better, more cost-effective outcomes for patients. Once those three fundamental issues have been addressed, there then comes a range of technical issues, which I just want to spend some time talking about now. On the graphic, you can see there's a separation between issues which are raised on the blue line and issues which are raised on the orange line. In terms of those issues which are connected to the blue line here, this is around developing a baseline and establishing what's known as a counterfactual. The baseline is about understanding what are the current costs and outcomes that are being delivered. And the counterfactual is concerned with what are the projected costs and outcomes if no change to delivery is made. Both of these need to be established before an economic evaluation can be undertaken. And once an economic evaluation is underway, we need to move into the consideration of data collection. A data collection mechanism needs to be established which regularly returns information on costs and outcomes to populate the cost effectiveness model. The costs will include data on setup and ongoing costs, and there will need to be an agreement around issues such as the allocation of shared overhead costs and fixed costs. In terms of outcomes, these are most likely to come from an impact evaluation, and you could be measuring a range of outcomes. The most common will be final outcomes such as improved health status, but you might also be interested in measuring intermediate outcomes depending upon the timing of the final outcomes. In addition, process metrics can be measured if these are thought to be of important benefits associated with the program, for example, improved patient engagement. These kinds of process metrics are likely to be of significant value in formative evaluations. In this area, bringing in specialist health economic expertise is vital, as getting these aspects right at the beginning is essential for getting an economic evaluation that is robust. What I want to cover now is what kind of results can be produced by an economic evaluation. The first idea I want to talk about is something called cost-consequence analysis. This presents costs and benefits in what might be considered a balance sheet format. It presents a list of costs and a list of benefits and allows the reader to compare the two. It is useful in formative evaluations and evaluating programs that are partway through implementation and where more economic information is needed to inform the design and implementation of the program. Qualitative information can be used as part of this analysis and incorporated within the balance sheet, and it does allow the reader to use their own subjective interpretation of the importance of different outcomes. However, it is unlikely to provide a definitive assessment of value for money of the overall program. Another form of analysis which I would like to consider here is what's called cost-benefit and cost-effectiveness analysis. This calculates the relationship between costs and benefits using a cost-benefit ratio or a cost-effectiveness ratio, or presenting a net present value of costs and benefits. If doing a cost-benefit analysis, it does require financial measurement of costs and benefits, although in a cost-effectiveness analysis, we can relate the costs to improvements in health status and health outcomes. It can be used alongside qualitative information, but this needs to be presented in more in a narrative format, which can help understand and interpret the contextual situation. The aim and the objective of a cost-benefit analysis and a cost-effectiveness analysis is to try and provide a definitive answer to the question, did the program or did the intervention deliver and demonstrate value for money? What I want to talk about now, beyond the presentation of findings and the nature of the economic analysis, are some analytical issues that also need specialist economic input. The first is the issue of discounting. Economists recognize that benefits that are delivered in the future need to be discounted, i.e. they need to be adjusted to reflect the fact that we as individuals and society as a whole value benefits that are received now more than they are valued in the future. A second issue is that of attribution, and this is related to the issue of the counterfactual that I mentioned earlier. An understanding of both the counterfactual and the logic behind why the proposed program has caused the observed outcomes is necessary. Now, in clinical science, this is achieved by using control groups, but this is unlikely to be possible when we are looking at the implementation of new models of care in an actual practical setting. There are other forms of developing a counterfactual and developing an understanding of the causal link. And this can involve comparing impacts over time or with similar areas, or by using statistical techniques, which are called quasi-experimental approaches, which can mimic the effect of a control group. Another issue to consider is the issue of missing data and missing economic data. Management information systems are, understandably, designed and set up to inform the operations and management of an organization, and the needs of an economic evaluation are likely to be different. Some data might not be available, or it might be collected in a different format. An initial review of the data early on in the evaluation is necessary to determine whether any adjustments or any other data sources, for example, speaking to subject matter experts, is necessary. Fourthly, the issue of sustainability of impacts is important. Some consideration will need to be made about what measures are in place to ensure that there are sustainability of outcomes over time and how likely this is. And if possible, we should consider the long-term impacts on both costs and outcomes. So what are the specific issues around the economic evaluations of new models of care and integrated care schemes? The first thing I'd like to consider is about identifying the expected benefits of an integrated care scheme. There needs to be an agreement across the organisations involved and patients and carers about what are the expected benefits associated with the new model of care. The concepts of improved health outcomes, patient experience and value for money are typical, but these may need to be refined to reflect the health needs of the local population. Also, given the financial pressures that I've mentioned earlier, affordability is also likely to be an essential criterion. Secondly, experience has shown us that there are significant data differences and gaps when we bring together separate organisations. Different organisations will collect and organise their cost and activity data in different ways, reflecting the current service delivery models and organisational design. For example, block contracts are unlikely to have unit cost activity data associated with them, and organisations which provide services for more than one commissioner may not segregate their cost and activity according to commissioner boundaries. Work will need to be undertaken, potentially using an agreed set of assumptions, to identify and clarify these uncertainties and to make adjustments as necessary. And finally, with regard to these issues, there's the issue of defining and costing new service delivery models. Evaluating and costing the impacts of a new service delivery model will require such models to be running, generating outcomes, and tracked over time. These delays may not fit within the pressures required to demonstrate and report value for money. As such, intermediate or process metrics might need to be used, supplemented by a strong narrative explaining why these intermediate metrics are likely to generate the expected long-term outcomes. So, after commissioning an economic evaluation, in conclusion, why should you do this, and what should you expect in terms of an economic evaluation of your Vanguard scheme and new model of care? Well, first of all, NHSE, as I mentioned, are likely to expect you to be able to demonstrate value for money through such an economic evaluation. But in addition to that, getting a full economic evaluation can be extremely valuable and informative to local teams, boards, and key decision makers. If done correctly, it can provide an understanding of the relationship between expenditures, processes, outputs, and outcomes, and can provide a more detailed understanding of the big cost drivers and how risks around financial affordability can be mitigated. It can also give you an ability to demonstrate to others, for example, senior managers, how the new model of care demonstrates value for money and why it is essential for the sustainability of the local health economy. It can also provide a template for how to monitor and evaluate on an ongoing basis the effectiveness and efficiency and economy of the local health services under the new integrated care model. And it can also provide an understanding of the gaps and inconsistencies in management information data collection that might be contributing to any current issues associated with running a local healthcare system. What I've provided here is a run through of how you might go about commissioning and undertaking and some of the issues associated with an economic evaluation. This slide provides some useful evaluation resources which have been presented in earlier webinars, and in particular the issues identified in the Treasury Magenta book can highlight some issues around economic evaluation. At this point now I'd like to hand back over to Caitlin, who will be responsible for overseeing the questions. Thank you very much for listening.
Great, thank you very much for that, Gareth. We've received quite a few questions so far, but as a reminder, if you have a question that you'd like to submit, there's still time. Just type your question into the questions box on the GoToWebinar panel and hit submit. Gareth, the first question we have for you is, how long does it take to conduct an economic evaluation? What's the shortest amount of time it can be done in, and what's an ideal amount of time?
Thank you for that question. Yes, it's a very good one, because there is an issue around ensuring that resources are being spent effectively and efficiently across the NHS. And obviously we want to ensure that an economic evaluation is one that is of value for money in itself. In terms of this, there is probably an optimal point. I can't give an exact answer to that question because it will very much depend upon the scale of the issue which we're trying to address, the availability of data, the complexity of the service delivery model. So what I would encourage people here to do is to think about very much about what are the questions you're trying to answer. And a good economic evaluation and a good provider of economic evaluation services will be able to work with you to enable you to identify what are the key questions that you need to address, how that can be built within an existing framework, and using reference to the Treasury ROMEF model and the NAO value for money model will enable you to identify what are the key priority questions, and then enable you to frame an economic evaluation which actually answers your needs, enables you to respond to the questions and the challenges that you're being posed.
Okay, thank you very much. The next question we have is, in your experience, you've already mentioned the missing data element. So in your experience, how do you conduct an economic evaluation without or with very limited data?
My approach to this is very much one of trying to be pragmatic about data sources. Whilst we would love very much to be operating in a world of complete certainty and relying on information such as those that come from clinical trials or perfect management information, that is very rarely the case when we're operating in this kind of policy analysis world. So how I do work on this, and it is very much around trying to understand, as I said, what are the key questions, perhaps undertaking initially a cost-consequence analysis, which enables, as I said, the potential data gaps to be identified, and then we can use that as a framework for building out a more definitive summative evaluation, trying to address the questions of value for money and cost effectiveness by then trying to identify new data sources. There is also the question around how accurate and how precise we need to be. There is a question about how perfect the data needs to be, and at what point is the data that's available, which can be triangulated through other data sources, regarded to be sufficiently adequate to give the answer, at least in the terms of the scale of the problem and the scale of the cost effectiveness. If your cost effectiveness ratio is so strong and it demonstrates value for money, then having perfect information may not be an essential point. The challenge and the trick of a good evaluation there is to test where there are key assumptions that are being made, where other data sources have had to be used to ensure that those other data sources are reliable and can be incorporated within the evaluation, and using that to test the overall strength and validity of the overall economic evaluation.
Okay, great. Thanks, Gareth. Unfortunately, we've run out of time today. If we didn't get to your question, please feel free to email us and we will follow up with you directly. The recording of this webinar will be available within the next 24 hours and available on our website. Our fifth webinar in this 6-part series is on the 26th of April and will be with Jackie Melander, and she'll be talking about rapid cycle evaluation. Thanks again for joining us, and thank you, Gareth. And we hope you'll be back at the next Optimity Advisors webinar. Thank you.